Hey, this is not so complicated. Today we'll be talking about glucocorticoids. These are adrenal hormones and analogs of these hormones. We'll be talking about that. So let's begin without further delay. So glucocorticoids like prednisolone or hydrocortisone, these are steroids, right? So they are primarily used for inflammation, autoimmune diseases, and adrenal insufficiency. And also the figure attached right here is the hierarchy of release of cortisol, that is endogenous glucocorticoids. So how that is getting released? The impulse begins from hypothalamus that releases CRH to stimulate anterior pituitary hormone, and that releases ACTH that stimulates adrenal gland. Adrenal gland also, there are two regions, adrenal cortex and medulla, and in cortex there are three regions, three layers, glomerularis and fasciculata and reticularis. So from fasciculata, these glucocorticoids are getting released, and in glomerularis, mineralocorticoids like aldosterone are released. From reticularis, what are released is sex hormones, and then from adrenal medulla, these are epinephrine and norepinephrine, right? So let's talk about mechanism of action of glucocorticoids. So these are lipid-soluble hormones, so they easily cross cell membranes, binding cytosolic glucocorticoid receptor, forming a glucocorticoid receptor steroid complex. So that complex is formed, right? And this complex then translocates to the nucleus, actually binding to glucocorticoid response elements and DNA. This DNA have response elements for glucocorticoids. So these complexes bind to that response elements to regulate gene transcription, right? So what is the ultimate outcome is that they upregulate anti-inflammatory proteins like annexin-1 and downregulate pro-inflammatory cytokines like interleukin 1, TNF, that is tissue necrosis factor alpha, by inhibiting NF-κB, right? So this is how anti-inflammatory action of glucocorticoids is actually done. So there are genomic action and non-genomic action. So these are two different actions. This is genomic action, and then non-genomic actions is that they increase gluconeogenesis, lipolysis, and then protein catabolism, ultimately raising blood glucose and mobilizing energy. So these are non-genomic mechanism of action of glucocorticoids. So you have to remember both of these. So this got cortisol, impaired incretin secretion, insulin resistance, protein degradation, low glucose uptake, and increased glucagon, decreased insulin. These are the effects of cortisol. Visceral obesity, insulin resistance, dyslipidemia, and insulin resistance again in liver, and in they also do gluconeogenesis, that is the formation of glucose from non-carbohydrate sources. So the cortisol usually increases blood glucose level. So if there is a case of hypercortisolism, that is the increased release of cortisol, then that will lead to adrenal diabetes. This is very high yield for USMLE. You can note it down, right? So the side effects of this are that, right? So hyperglycemia occurs, weight gain, and Cushingoid features. What are Cushingoid features? Is that like there is distribution of fat, buffalo hump or round face is seen. So these are Cushingoid features. And then musculoskeletal, what happens is osteoporosis, that is in long-term use, bone loss, and myopathy that causes muscle weakness, right? And in immune system, what actually happens is that there is increased infection risk because of immunosuppression, right? And mood changes like irritability, psychosis, cataracts, and skin thinning also are the side effects of these drugs. And what is the difference with mineralocorticoids is that mineralocorticoids like cortisone acts on mineralocorticoid receptor, increasing sodium reabsorption and BP. How BP? Because where there is sodium, there is water, right? So with sodium reabsorption, there is water retention also, that is increasing blood volume, and that will lead to increase in blood pressure. So they are usually used in hypertensive cases, but in hypertension cases, these are contraindicated. So mineralocorticoid antagonist, right, like angiotensin converting enzymes, these are the pathways, like pathways inhibitor, RAS system inhibitor. So aldosterone works from RAS pathway, right? And also, so you can impact the entire cycle from ACE inhibitors and then angiotensin receptor inhibitors, direct renin inhibitors like aliskiren. So this is the pathway that mineralocorticoids is working. So that is all about today. That is all about you who have to know about glucocorticoids. Subscribe for more clinical polls like this. Thank you for staying with me. Please subscribe. Yes.